Hi, I'm back. So I will. This is probably my first real topic about chronic pain, and though the idea is it's chronic pain, I'll be talking about the first few stages of my experience with it. So it's a bit odd that it's only. So the time frame I'm looking at is probably the first month, 2 or 3, up to 3 or 4 months living with chronic pain. So everything is due kind of fine and dandy until it pushes a bit further in. So the first stages in the topic that I'll be talking about today is about doctors. So how doctors work is they generally do a step-up process. So you go see them, they might diagnose you a bit, and then give you something to try. And if it doesn't work, you go back to them, and then they step up with the way they deal with things. So whether it's scans or going to the specialist or physiotherapy, it's more of a step up process. And every doctor is a bit different. So the step up process can be slow, can be quick. So it's all dependent on the doctor, but generally a bit slow because in this world we want to use our resources appropriately. So they generally don't go for the extreme stuff like what you see on House on TV, where they do everything at once, which is the perfect scenario. So with that approach, sometimes it can take a while for the doctors to push things through. And I just want to say that sometimes you need to be quite firm with the doctor. And I don't mean that you should go to the doctor and knock on their door and go like, I want to get this done. But what I mean is that through discussion, through with the GP discussion, and the doctor said, oh, well, it won't hurt if you really wanted to get done. It won't hurt if you get the scans done. It won't hurt if you go see the specialist just to get an opinion. Then by all means, if that's what you want, you should get it done. Reason why I'm saying is sometimes I have a couple of patients where they tell me that they want to try this drug, or they want to try a new therapy, or you do a scan. Generally the GP will say, well, you don't really need it yet, I don't think you need it. But I think and I tell them, if you think in your opinion you think you want to get it done, you should go and get it done and be firm with the doctor. So my point is that you do need to be quite firm with the doctor because of the step-up wise approach into medicine. The other thing is I want to say that it's a good idea to get a second opinion. I don't know how to explain it. Just go and get a second opinion. When you do get a second opinion, try not to tell the second doctor what the first doctor said. Try to be as clean slate as possible. Reason being is that no doctors want to diss other doctor. I, as a pharmacist, try my best not to diss other pharmacists. Just the way we do. We try to protect ourselves. And everyone, and it's not just protecting ourselves. It's also everyone have their own different opinions. So that's why you're getting a second opinion. The other thing that I want to talk about is doctors don't know everything. Scans won't tell you everything. Physio is not going to tell you everything. A specialist is not going to tell you everything that you may want to know. I want to pause because that's quite important. Because sometimes you really want to know what caused the problem. You really want to know what the problem is, why you're having the pain. Sometimes they won't tell you the answer, and you just have to accept it. And there's nothing I can do. I don't know what I exactly did to this to cause me this pain. I still don't know what exactly is the cause, and this is 8 months down the track. Everyone's got a different opinion. Every month, everyone tells me something different, and I can understand it gets so frustrating. But you slowly accept that there's nothing you can do to get the answer. This is even with blood work done or scans done. Nothing is for certain, and it's hard not knowing exactly what the problem is. But the information is still helpful. For example, they told me what they think might have caused it. Maybe I was moving house, or the exercise I've been started to do might have caused the problem. Maybe not drinking as much water. So these things help me prevent future problems again, and I might hurt myself again. So I know it's hard not knowing exactly the answer, but just have to deal with it. Another thing that I want to talk about is different health professionals. You've got pharmacists, physio, surgeons, GPs, chiro, psychologists, everything, and you have to accept that they all will prescribe their treatment according to what their job is. So as a pharmacist, I give you drugs for you to take, and if you see a surgeon, they're more likely to cut you open. If you see a psychologist, they think the problem is in your head. If you see a physiotherapist, they think it's your posture that's wrong. If it's a chiro, then they might think it's something wrong with whatever. If you see an acupuncturist, they'll think it's something with your pressure points. It all gets really confusing and very annoying to know what exactly you should do. And I understand, and I offer you no answer, but I feel your pain. And it's hard to decide what to do, because sometimes it might be contradictory what you should do. But I will say that your GP, having a good GP is great, because they centralize, they're not really specialized in everything, and they offer a good advice, professional, health professional advice, instead of you deciding for yourself whether you should go to a chiro or whether you should take more drugs or whatever. So your GP is key to bringing it all together. So you do need to tell your GP what exactly you're doing. And I think that's all about pharmacists. I did not pharmacists, doctors. I hope you enjoyed it. I'll try and post something up. I've still got a few topics to go through, so I will be posting quite a bit up. 7 minutes, I think it's pretty good. Take care.